This is the last of the buttock muscles, which is the piriformis. So just to give an idea of anatomy, I'm going to follow the iliac crest around like that, then the sacrum, which carries on down here like that. Now, the other very important and anatomical landmark is the greater trochanter of the femur, which is here. So you have the iliac crest, sacrum, and the greater trochanter, which you can feel. And from here to here is where the piriformis arises, there to there, and it actually attaches to the anterior aspect of the sacrum. It then runs across the buttock and attaches into the top of the iliac, of the tuberosity. So it runs like this, and it is deep. It's a deep muscle. So the gluteus maximus overlies this muscle and runs down. The piriformis is incredibly important because there's one other anatomical structure which you cannot feel, which is the greater sciatic notch, which runs here and there. So what happens is this muscle runs across the sciatic notch, firstly deep, and then comes through it and then attaches into the top of the tuberosity. So the muscle itself has its functions are very complex, because if the leg is straight like this, the way this attaches, what it'll do is it will help to flex the leg, but it's a weak flexor, and its attachment, it actually wraps around slightly, and it will externally rotate the leg. If you have your leg bent, so now it's pulling in a different direction, because now the leg is bent this way. As it contracts, it will actually abduct your leg. So, and then as you're going in between there, it will do a mixture of those movements. So that makes it a very, very complex muscle. Its primary function is as a rotator of the hip. The real key with this is that the piriformis has a very close anatomical relationship with the sciatic nerve, which usually comes out about here. The sciatic nerve runs out there, and it comes from below the piriformis, but it has a variable relationship, and there are rare occurrences where it divides. Half of it comes through here, and there's even more rare where it comes from above. Then you can see that if the muscle were to contract, it could impinge on the sciatic nerve in these distributions. And this is why the muscle itself gets trigger points. The trigger points have a local pain relationship, but if it impinges on the sciatic nerve, then it will create true nerve-related pain, neuropathic pain, and you will get a pain that shoots, that runs in the distribution of the nerve that it is pressing on, and has associated numbness and tingling. So the piriformis has two triggers, and if you divide the muscle into three, so there's here and here, these are the two triggers. First division, second division. This is term trigger 1, and that's term trigger 2. The trigger point 1 creates pain locally in this area. So it's deep within the buttock because the piriformis itself is deep. It's a deep rotator. The second gives a pain distribution over this area. So those are the trigger points. When it impinges on the nerve, it gives pain shooting down the leg, as it would if you were to impinge on the nerve anywhere. Occasionally, especially this trigger, will refer in a kind of vague distribution down the leg, but that's not the same as the neuropathic, the sciatic distribution, which is a thin band. So they're quite different. The trigger points give localized ache and occasionally a broad dribble down the leg, but the impingement on the nerve will give pain shooting in the distribution of the nerve. I just mention one more thing of interest, and that is that the piriformis is one of 5 rotators of the hip joint. And they all run parallel to each other down the buttock. There are the gemelli, the obturator internus and externus, and they all come in and wrap around the trochanter of the femur. So they all are deep muscles, and their functions, when they get trigger points, are very similar. So that the trigger points of the trapezius and of the obturator and the gemelli all, and the last one is the quadratus femoris, which is a big strong muscle. All of these will laterally rotate the hip. The complicated one is this one because it attaches right in the top, and its relationship changes as the hip moves. So if we now look at these 2 triggers, remembering that the muscle is deep, so you're pushing through the glute max, you're pressing down, and as with all, what I do is I search for, and this is a very, very common trigger. As you're feeling, the iliac crest comes here, the sacroiliac joint sits there, and just on the inside of that is the piriformis trigger. And for people who examine and people who've got hip pain, this is super common. Just on the inside, you go deep, and the person just about jumps off the table. So I'm putting quite a lot of pressure, and then I'm watching his face, and I say, look, you remember that we have, because this is very sore, and because you want to protect your own hand, you support your thumb. You support your thumb, push down until you get pain, and then you use the ischemic principle of staying just below the pain threshold, gradually increasing the pressure, increasing until the trigger melts away. It's difficult to feel the piriformis. If you've got somebody who's really, really thin, you may be able to, but the gluteus maximus is so much bigger and bulkier that the piriformis tends to get hidden. You just got to know where to find. So that's the first trigger, right inside the hook between the iliac crest and just the sacroiliac joint, and you tuck in there. And the second is further lateral, and again you just divide 2/3, and it's pretty close to the musculotendinous junction. And again, deep press in there. In fact, I can feel something. Yeah. So as I go down, that was sore, and I could feel a tight band there, and I could feel a trigger. So I'll stop pushing, and I just again pressure, gradually increase the pressure, keeping below the pain threshold, starving the trigger point of really basically of blood flow and of function. and it just melts away under your hand. Okay, so that is the treatment of ischemic pressure. So another way to treat is using cold and hot. So this is an ice pack. You start at the origin and you go into the insertion and then down into the pain zone. Origin, that sort of rate, fair bit of pressure, slowly, and then down into the pain zone. You do 2 or 3 like that. Then, to stretch the muscle, you put the leg into flexion and drop down. So I hold, no, sorry, just like that. That's good. There. And you can see that that has stretched the muscle. Then you can do 1 or 2 more runs with the muscle on the stretch. Then you take a heat pack, apply the heat pack, leave that on for 10, 15 minutes, take it off, and then you do the stretch again, over and down.